Did you know that in the time it takes to watch this video, about 20 seniors will receive a dementia diagnosis? That's one every 66 seconds. But here's the chilling part. What if it's not just aging? The answer might be hiding in your medicine cabinet. You've been told these medicines are safe, routine, and even necessary. However, new study is raising the alarm. 99% of seniors are unaware that at least one medicine they are taking can reduce crucial memory regions in the brain by more than 28% in less than a year. Let that sink in. What about the pharmaceutical industry? It has known this for decades. Nonetheless, they reap billions by selling the same pharmaceuticals that may hasten cognitive deterioration in millions of seniors. In fact, a 2023 study in neurology and aging research discovered that one class of medications raised dementia risk in elders by 49% after only 2 years of use. In this video, we will show the 9 most dangerous medications that cause rapid memory loss and dementia, graded from widely overlooked to mind-destroying. And number 3. It's prescribed to millions for something innocuous, but it can diminish important memory areas in your brain, and you probably have no idea it's doing so. Before we begin, please share in the comments what medications you take daily and whether you've ever experienced sudden brain fog or forgetfulness. We read every single comment and respond with personalized advice. Don't stay silent. Your story could help others too. And if you find this video helpful, remember to subscribe, like, and share so you won't miss out on future tips that support your health. This could save your sanity. Without further ado, let's begin at number 9, and don't let its position fool you. This one appears in practically every senior's cabinet. It could be disrupting your brain before you realize it. Number 9, Diphenhydramine or Benadryl. Diphenhydramine is the pink pill that millions rely on to help them sleep, relieve allergies, and alleviate cold symptoms. It's inexpensive, available over the counter, and most likely already on your nightstand. You may believe you're using Benadryl to help you sleep or treat allergies, but it might also disturb the hippocampus, which is crucial for storing new memories. Benadryl is an anticholinergic medication, which inhibits the neurotransmitter acetylcholine. This is a hormone that allows your brain to build new memories and stay attentive. The older your brain gets, the more it depends on every bit of acetylcholine it has, and when this medicine interferes with that process, the consequences can be disastrous. According to a 2023 study published in the Journal of Geriatric Cognitive Health, seniors who used anticholinergic medicines on a regular basis were 54% more likely to develop dementia than those who did not. So, how can you protect your memory? First, avoid anything containing diphenhydramine, especially if it is labeled PM, evening, or allergy relief. Frequently, these are simply disguised Benadryl. If you're using diphenhydramine for allergies, there are newer non-sedating alternatives like loratadine, also known as Claritin, that do not pass the blood-brain barrier and are far safer for long-term usage in seniors. Never discontinue a drug abruptly, and never assume that over-the-counter equals safe. The next drug is typically touted as safe and soft on the stomach, but it can interfere with the nutrition your brain requires to stay sharp. 8th, proton pump inhibitors. Prilosec and Nexium are proton pump inhibitors, PPIs. These medications are intended to lower stomach acid and are frequently recommended for heartburn, GERD, and acid reflux. Many seniors continue to use them for years, if not decades, because their symptoms return as soon as they quit. What is rarely highlighted is how PPIs interfere with the absorption of vitamin B12, a critical essential that protects the brain and promotes memory, focus, and emotional stability. In a 2016 study published in JAMA Neurology, researchers evaluated more than 73,000 persons aged 75 and older and discovered that regular PPA users had a 44% higher chance of developing dementia than non-users. PPIs impair the body's capacity to absorb not only B12, but also magnesium and calcium, which are required for neuronal transmission and brain cell communication. Without them, neurons fail to fire efficiently, resulting in misfiring, disorientation, and memory lapses, which frequently resemble the early stages of Alzheimer's disease. However, the problem goes much deeper. PPIs have also been linked to an increase in amyloid beta plaques in the brain, which are harmful proteins that affect brain function and are thought to be a primary cause of Alzheimer's disease. The good news is, there are safer options. If you take a PPI on a daily basis, ask your doctor if you can gradually reduce your dose with H2 blockers such as famotidine, often known as Pepcid. While not ideal, H2 blockers are less likely to impair cognition. Also, consuming a bit of deglycyrracinated licorice, a natural substance that coats and calms the stomach lining, can provide symptom alleviation without causing cognitive impairment. The next medicine is commonly used for bladder control, although it may be interfering with short-term memory and emotional equilibrium. Number 7. Bladder control medicines. Oxybutynin, available under the brand name Amitriptyline, is commonly administered to seniors who suffer from urine incontinence or an overactive bladder. On the surface, it appears to be a practical answer. Nobody wants to deal with the shame or inconvenience of frequent restroom visits. But this medicine acts by inhibiting acetylcholine, the same brain molecule disrupted by Benadryl. And, unlike some milder anticholinergics, Oxybutynin passes the blood-brain barrier more quickly and has a direct effect on memory areas in the hippocampus. This makes it particularly harmful for elders, especially when used for extended periods of time. In a 2019 study published in the BMJ, researchers discovered that adults over 65 who took powerful drugs, such as Oxybutynin, for more than a year, had a 49% increased risk of acquiring dementia. That's almost 1 in 2. What's more disturbing is that many seniors are never informed about the cognitive negative effects. They are just told that medication will help with bladder control, not that it may hasten mental decline. The harm is frequently misunderstood for regular aging. Patients report feeling foggy, missing appointments, misplacing items, or suddenly failing to keep up with conversations. It is rarely traced back to the medicine until the damage has occurred. So, if you're taking Oxybutynin and you've seen any mental changes, it's not all in your head, and you don't have to keep taking the medication to stay in control. Fortunately, newer drugs, such as mirabegron, marketed as Mirbitriq, work through a different mechanism and have a substantially lower impact on memory. These medications do not inhibit acetylcholine and are typically seen as safer for older persons. Statins come in at number 6. Statins are among the most commonly prescribed medications in the world, particularly for those over the age of 60. They are intended to lower cholesterol and minimize the likelihood of heart attacks and strokes. The two most commonly used are simvastatin and atorvastatin, which are marketed as Zocor and Lipitor, respectively. But this is where the difficulty begins. Cholesterol is essential for the brain as well as the heart. The brain is about 60% fat, and cholesterol helps to create and maintain the myelin sheath, a protective layer that allows nerve messages to pass smoothly. When you aggressively cut cholesterol, you may be depriving the brain of what it requires to function. In a 2023 study published in Frontiers in Aging Neuroscience, seniors over 70 who had been using statins for more than 3 years had a 26% increased chance of mild cognitive impairment, and those on high doses showed significantly greater decreases. What's more troubling is that some patients claimed rapid onset memory loss, stating that they couldn't recall names, recent conversations, or even familiar driving routes. It's vital to recognize that not all statins have the same effect on the brain. Some, such as pravastatin and rosuvastatin, do not easily pass the blood-brain barrier and are therefore deemed less dangerous in terms of cognitive adverse effects. If you've been taking statins for a long time and are experiencing fog, forgetfulness, or confusion, it's time to talk to your doctor about reducing your dose or trying a different method. Do not wait until it is irreversible. The sooner you take action, the higher your chances of safeguarding your intellect for years to come. Number 5. Benzodiazepines. Benzodiazepines, such as lorazepam or Ativan, diazepam or Valium, and alprazolam or Xanax, are among the most commonly given treatments for anxiety and sleep disorders. They work by increasing GABA, the brain's calming neurotransmitter that prevents overstimulation. At first, they appear to be lifesavers. They calm the mind, reduce panic, and aid with sleep. However, these medications eventually transform into something altogether else: a trap. A 2022 study published in the BMJ tracked over 8,000 seniors for 6 years and discovered that those who took benzodiazepines for more than 3 months had a 51% higher risk of acquiring Alzheimer's disease. Long-acting benzos, such as diazepam, pose an even greater risk because they linger in the body for extended periods of time and accumulate in fatty tissues, including the brain. What happens is a type of pharmacological sedation that reduces brain activity. This means that your brain no longer learns as quickly. It loses flexibility and efficiency and is more prone to disorientation, memory lapses, and emotional dullness. Seniors on benzos frequently describe feeling in a daze, detached, or simply not themselves. The worst thing is that when they try to quit, withdrawal symptoms such as anxiety, agitation, and insomnia can be severe, making the drug seem necessary when it is the source of the problem. Here's how you can fix it. If you've been taking a benzo for more than a few weeks, don't stop abruptly. This might be harmful. Instead, work together with your doctor to progressively reduce the dose. Alternatives, such as buspirone, a non-sedating anti-anxiety medicine, or cognitive behavioral therapy for insomnia and anxiety, can help restore calm without preventing memory loss. Amitriptyline, or Alevel, comes in fourth. Amitriptyline, often known as Alevel, is an older antidepressant that is still regularly taken for pain, insomnia, and, in certain cases, migraines. At first glance, it may appear to be a multi-purpose miracle drug, but beneath the surface it is one of the most potent anticholinergic drugs still in use, which means it inhibits the activity of acetylcholine, the neurotransmitter that allows neurons to interact, establish memories, and stay sharp. In fact, it blocks it so effectively that the effects on cognition are not only possible, but also expected with prolonged use. In a large 2015 study published in JAMA Internal Medicine, researchers looked at over 3,400 persons aged 65 and older and discovered that those who used higher cumulative doses of anticholinergic medicines, like amitriptyline, over a 10-year period had a 54% higher risk of acquiring dementia. That's not a minor increase, it's more than half the typical risk. What's worrisome is that many of these individuals were not informed that the medicine could impair their memory. They were frequently administered amitriptyline for sleep problems or nerve discomfort, and they gradually noticed effects such as short-term memory loss, word-finding difficulties, and clouded concentration. It does not require a big dose to produce issues. Even low-dose amitriptyline, used nightly for several years, can cause a gradual, imperceptible loss of brain function. The harm occurs silently, with no indications or symptoms at first, only a slow deterioration that appears to be aging but is actually drug-induced cognitive impairment. So, if you or a loved one is on amitriptyline, consult a doctor about alternatives. Options for nerve pain, such as duloxetine or gabapentin, may provide relief without the same level of anticholinergic load. For sleep, melatonin or low-dose doxepin, which has a considerably milder anticholinergic effect, can be administered instead. And for mood support, newer antidepressants such as sertraline or escitalopram are generally seen to be safer for the brain. Number 3. Paroxetine, or Paxil. Paroxetine, sold under the brand name Paxil, is one of the most often prescribed selective serotonin reuptake inhibitors, SSRIs, for depression and anxiety. At first appearance, it appears to be a new antidepressant that is meant to be kinder than previous generations of medications. But here's what they don't tell you. Paroxetine is the only SSRI having considerable anticholinergic activity, which means it interferes with acetylcholine in the brain. That single difference distinguishes it from its SSRI counterparts, such as sertraline or escitalopram. In a comprehensive 2021 review published in Frontiers in Psychiatry, researchers looked at the cognitive characteristics of elderly individuals on several SSRIs and discovered that paroxetine users saw notable losses in short-term memory, verbal recall, and attention span within the first 12 months. The study also discovered that seniors taking Paxil were 30% more likely to experience early indicators of cognitive deterioration than those taking other antidepressants. The irony is that it is frequently given to calm mood, yet it ultimately undermines mental clarity and emotional stability over time. The solution here is simple yet necessary. Avoid Paxil altogether. The American Geriatric Society has included paroxetine to their Beers criteria list, which is a list of possibly unsuitable drugs for older persons. If you're taking it, talk to your doctor about switching to a safer option, such as sertraline or escitalopram, which are better tolerated and don't pose the same cognitive hazards. Furthermore, supplementing with B vitamins, particularly B12 and B6, might naturally improve mood. Antipsychotics come in second place. This one is especially concerning because many seniors are unaware they are taking an antipsychotic. Drugs such as quetiapine or Seroquel, risperidone or Risperdal, and olanzapine or Zyprexa were first designed to treat schizophrenia and bipolar disorder. However, they are now frequently prescribed off-label to elderly patients for sleep problems, agitation, or behavioral changes caused by dementia. That's correct. These pills are intended for severe psychiatric disorder, yet they're being used in nursing homes and hospitals to treat seniors who are just disoriented, restless, or difficult to manage. The repercussions are severe. In 2022, a comprehensive research in the Lancet Healthy Longevity monitored over 25,000 older persons and discovered that seniors taking antipsychotics for behavioral symptoms were 71% more likely to suffer increasing cognitive loss after 12 months, even if they had no prior history of dementia. Worse, these medications raise the risk of stroke, sudden death, and acute drowsiness, which can result in falls, hospitalization, or permanent institutionalization. The mechanism is severe. These drugs reduce dopamine, a neurotransmitter that is not only associated with mood and motivation, but is also necessary for executive function and memory processing. When dopamine levels drop, the brain becomes sluggish and unresponsive. This is why seniors using antipsychotics frequently appear dull, emotionally lifeless, or zombified. Their personalities vanish, and family members begin to mourn someone who remains physically present. The first step toward resolving this dilemma is to ask difficult questions. If you or a loved one is taking one of these medications, ask the doctor why it was recommended and if it is genuinely essential. Non-drug therapies, such as adopting structured routines, decreasing noise and overstimulation, addressing pain or discomfort, and enhancing lighting and sleep hygiene, can often help manage behavioral symptoms. When medications are absolutely necessary, taking lesser doses for shorter periods of time can help reduce harm. However, in most cases, these medicines are utilized for convenience rather than need. The difficulty is that many families are not even aware of what these medicines do. They only observe their loved one decline, unaware that the cause is chemical rather than natural. Number 1. Anticholinergic Polypharmacy. This is the hidden danger that practically no one discusses, yet it is one of the leading causes of drug-induced dementia among the elderly. You might anticipate a single treatment to top this list, yet the most risky medication for fast dementia in seniors is not a tablet. It is the stealthy, creeping effect of taking many anticholinergic drugs concurrently, often known as anticholinergic polypharmacy. Consider this scenario. A senior uses Diphenhydramine for sleep, Oxybutynin for urinary problems, and Amitriptyline for discomfort. Each may produce minor memory issues on its own, but when combined, the cumulative anticholinergic load skyrockets. This is not merely a theoretical matter. In a 2022 study published in Age and Aging, researchers followed over 280,000 older persons and discovered that those with the highest anticholinergic load had a 120% higher risk of getting dementia within 10 years. That's more than twice the risk. Here's the worst part. Most of these seniors had no idea they were taking anticholinergic medicines. When you block acetylcholine from numerous directions at once, your brain does not simply slow down, it starts to degrade. Underuse kills neurons, shrinks synapses, and causes the brain to enter a hypoactive state similar to Alzheimer's. This can be fixed without a miracle. It demands a medication review. Ask your doctor or pharmacist to assess the anticholinergic load of all of your medicines, over-the-counter medications, and supplements. There are online tools and professional applications available to determine the cumulative burden. Once discovered, you can begin to deprescribe, gradually discontinuing needless drugs, switching to safer alternatives, and rebalancing brain chemistry. This is the most empowering aspect of the entire video. Drug-induced dementia is usually reversible. After the load is relieved, many elders regain clarity, energy, and memory function within weeks or months. The brain is resilient, but only if you give it a chance. Polypharmacy is not only harmful, but also preventable. As a result, this has become one of the biggest hidden threats to the mental health of our aging population. Now, we'd love to hear from you. Which medications are you currently taking? Have you noticed brain fog, forgetfulness, or even personality changes after starting something new? And are you open to speaking with your doctor this week about reviewing your prescriptions? Please share your thoughts and experiences in the comments below. We truly read them all. If you found this video helpful, don't forget to subscribe, like, and share it with someone who could benefit. Thank you for watching.